Hey everybody, it is your favorite stylist here. It is Melanie Day with You've Got Curls and Hair Loss Center. And as always, having something special going on and bringing on amazing guests. And tonight we have a fabulous guest, Dr. Eman Yousif. She is a internist, a medical doctor at Washington University at St. Louis. How are you doing tonight?
I'm doing great, Melanie. Thanks for having me.
Yes, I'm so excited. So before we get started, just want to let everybody know what our topic is. And our topic is getting to the root cause of hair loss in women. And I don't, when you first reached out to me, I was like really surprised. I was really excited actually, because I don't really know how tech works and algorithms and things like that, but you actually found me. So how did you find me again?
Yeah, so I'm an avid podcaster. Like I love listening to podcasts. That's how I consume most of my information. But often it's sort of in the medical world, keeping there's lots of ways to keep up to date now in terms of evidence-based medicine and that sort of thing. But kind of when we spoke, I shared this sort of hair loss, excess hair shedding was something a more personal thing that's I've been through and sort of recovered from, and I was sort of looking if other people were talking about it in the space. So I just kind of looked around what people were doing, what people were sharing, and how much of that was evidence-based and what sort of information was coming out. So that's how sort of I found you, and I was interested, especially as women of color. I was so excited to find you.
Yes, well, this is what makes it even more special. It's that part of it, but that there's like-minded individuals that are out there that are searching, but also looking for credible information. So tell me a little bit more about your background, because it's pretty interesting, but I want the world to know like what your background is medically and everything.
Yeah, so I'm board certified in internal medicine. I practice both inpatient, outpatient medicine. And our training as sort of internists, we think of systems. We essentially delve deep into how the organs are connected, and how different symptoms and diseases interplay between those sorts of organs. The skin, as we know, is an organ itself, and a lot of that stuff is very much tied into what's potentially going on in your body. So I think that's essentially basically what I do, as I try to connect the pieces and connect symptoms with what's going on in the body.
Yeah, so it's almost like a detective, right?
Yeah, for sure. I honestly, I enjoy it. It is like a detective, especially when you have the time and the relationship with your patients. When they share that information with you, I think it's really valuable for sure.
Yeah, and something else that I think you brought out in our conversation was mentioning as far as taking additional classes for nutrition. Now, is that something that doctors normally do or don't do?
No, I think you're right. A lot of people don't. I think I realized after finishing my own training, we do it's a lot of schooling, 4 years of undergrad, 4 years of medical school, and then between 3 to 7 years, depending on whatever training you or field you decide to do, of residency. So that's upwards of 11 plus years. And our nutrition education, unfortunately, it's not a secret, is limited to at most maybe a couple weeks to a month.
Wow.
And I realized that sort of deficit when I started taking care of patients outside of the hospital. They would ask me, "Oh, doctor, I have high blood pressure, I have diabetes. What can I do?" And often, unfortunately, the reflux is to have a dietitian sort of refer, to have that referral. But in hindsight, I realized that, these are conditions I see every day, all day during the clinic, and I should probably have a better understanding about what the interplay is between these chronic diseases, the symptoms that my patients manifest, and how to effectively treat them. That's beyond the tip. Unfortunately, I was one of those people who were eat less, exercise more, and I felt horrible. And I was like, I can't, like this, this cannot be the extent of my nutrition knowledge, especially when I'm advocating for preventative care, you know, eliminating inducing chronic diseases. And that's effectively the premise of how I practice. So
Okay. So eliminating chronic diseases and getting patients off their medications, right?
Yeah, that's my goal. That's probably my passion, and because a lot of I'm talking strictly about the ones that we know about, diabetes, hypertension, those sorts of things that are sort of diseases of affluence and environmental that are unfortunately chronic and endemic in our area, in the United States. Um, yeah, I think there's a lot of work to be done in terms of that area. And so those are the things that I'm primarily interested in.
I love it. I love it. We need more healthcare providers like yourself. I know they're out there. It takes time to find healthcare professionals that really want to spend time and getting to know why, if we're having certain
Yeah,
reactions, or um, helping patients to learn more about their bodies. And if something doesn't feel right, you know,
yeah.
helping them work through that. So let's talk about I guess the thought about your own journey, because I think you mentioned earlier as far as hair loss and what that was like. Tell me, what was that situation for you?
Yeah, so right, my interest in the hair loss, and I will say as a caveat, if you I'm just talking strictly non-scarring hair loss, so kelogen effluvium, androgenic alopecia. If you have scarring alopecia, I'll definitely have a dermatologist see you. This is not what we're talking about. We're talking about just the regular excess shedding, that sort of thing.
Right.
So, I will say if it wasn't the privilege I have for being a physician, being equipped with the knowledge that I had, I don't know that I would have even identified it early.
Wow.
And I think that's probably that's why I really want people to know that if you're experiencing something, just like any sort of symptom, in my mind, hair loss is a symptom of something else that may be going on.
Mhm.
And to not be afraid to share that with your doctors, because there's probably a reason why that's going on, and it's something worth investigating for sure.
Okay. So I like what you said. Hair loss is a symptom of something else that's going on. So what was it like I know for me, I think that's how you found me, was my
Mhm.
personal experience was I was on medication. It was a hormonal medication. I had really heavy periods, and
Mhm.
really heavy periods cause anemia. So the medication was just a byproduct of probably the underlying thing, which was the anemia.
Mhm.
So, like you said, hair loss is a symptom of something else that's going on. So, me as a patient, knowing this, what conversation should I be having with you as a medical provider to help me better understand what's happening?
Yeah, so that's a good question, because for myself, it's really, because I know how I get history from patients, I try to get a timeline from them. And I would say for other patients to also try to reflect back on what's been going on in the last couple of months. Have you started a new diet? This is where the nutrition component comes in. Especially if you're a high risk one, you're African American, woman, you go on a strict vegan diet when there's not a lot of iron potentially, especially if you're not doing it correctly, that could be a problem.
Right.
New stresses in your life, new illnesses, if you're getting
COVID is a
sick
big
more
one.
often. Yeah, well, I'm sorry.
COVID was a big one.
Oh, yeah, for sure. Absolutely. I mean, they're all related. If you start noticing new joint pain, new rashes, you're having digestive issues, that could be pointing to potentially the start of some new malabsorption issues, some new autoimmune disease. Um, Even if you're having heavy menstrual periods, or if that's changed, if it's something that's if your menstrual period has become more irregular, that could be pointing towards like some sort of PCOS, fibroids, endometriosis. It could be a lot of things, but I think the most important thing is to think about what's been going on in the last couple of months.
Yeah, so having that history, I like that. Now, the points that I think you were mentioning earlier was labs, the different
Mhm.
types of labs. Everyone, when you look online, people have so many different opinions. So say like, oh, well, you need to check your vitamin D levels, and you need to check your THS, like your thyroid levels and things like that. But what labs should I ask for when I'm seeing certain things happening with me?
Yeah. So kind of I'm trying to think of probably the standard labs, I think, are a good base to start with. So a basic metabolic panel, a thyroid hormone, a thyroid TSH, free T4, free T3, those are important as well. Vitamin D, also, and a complete blood count. From those, I think you can gain probably a baseline good information about what's potentially going on. And then expand from that. But I would probably, start with those couple of labs for sure.
Okay. So what about like if I wanted to check my zinc levels, or I don't know, because I have some clients that have come in and they've had all those tests run and everything checks out fine, but I'm still seeing, like you said, the
Yeah.
symptom of something else. I actually had one client, probably say she's in her 40s, and has children or whatnot, but we're still trying to figure it out. Hers looks like, pattern or genetic alopecia or thinning. But I also suspect that there might be something underlying going on there as well. But I'm not I'm not medical professional. I don't know.
Yeah.
But all her labs check out fine. So when a patient has that issue, what's the next step when things check out fine or okay?
Yeah, I would still probably harp back on kind of the history, because one, it could be other things. So is she eating enough protein? That's a big one. You need essential fatty acids to, make sure your hair grows. Zinc, of course, selenium, some of those micronutrients, and those are probably labs that we would run next. And probably maybe look at the labs a little bit more closely, because there are some fine kind of, so we only think about the hemoglobin, white blood cell count, and platelets, but there are more. When you see your labs, there's like 7, 8, 9 different labs, right? We don't we don't really talk about them. But personally, I'll tell you how I kind of found mine, because it wasn't my doctor. It was I just noticed that the trends, I look at trends, especially when I see my patients. I look at what's going on. Like, is your hemoglobin 13 and now it's 10? Maybe it's not a big difference, but it's gone down. That's potentially an early problem. But the RDW in your hemoglobin, in your complete blood cell count, can tell you that your iron stores are low. Then that happens before you're deficient, before you're anemic. That
Okay.
still means you're iron deficient. Even though you're not exactly anemic, your hemoglobin might be 10 or 11, nothing to be too alarmed about, but your iron stores are still low, and pretty soon you probably will be overtly anemic. But then by that point, it might be, you might have really serious, you start, having serious hair loss. But once your RDW is high, I would probably already start supplementing you with iron.
Okay. That is very interesting that you said that, because for me, like you can go on your My Chart or Epic or whatever your doctor uses, and you can see your labs, right? I have no idea what it is I'm looking at. So I go into Dr. Google, I type in this, and it's like, oh, well, you shouldn't be alarmed. This is pretty common. You see this with anemia. For me, my doctor, she put me on just the basic iron ferrous, so 325, 65 milligram is what she suggested for me. But what I find interesting about that is that, and it's interesting because I think in the material that you cited, I'm taking mine every day. And I wonder if I should be taking it every day.
Yeah, it's hard to keep up with the literature. And it's not anybody's fault. That's the previous thinking, is every day. It makes sense. You're iron deficient, take it every day, right?
Yeah.
But what they found in the more recent literature is every other day, because the body is smart. If it's seeing, super therapeutic, 500% more iron, it's not going to absorb it. It's going to be like, why are you giving me so much iron? I'm not going to take it. So it's sort of a mechanism. In my mind, this is what it is. Obviously, they don't explain it in the literature, but what they found is taking it every other day allows for better absorption, allows the body to better, understand that this is a new supplement that's coming in, and this is how I'm going to start taking it. And of course, you take it with some vitamin C. You can take a pill. I prefer telling my patients to eat like an orange or have it some like lemon water, anything like that.
Okay.
The more natural is better. Obviously, if you can take red meat or have full protein, that's even preferred. But when you're deficient, you need to take supplements until your stores are back to normal.
Okay, so you're saying that because I didn't know that, so I need to be following up with a vitamin C or lemon water or something?
Yeah, take your iron pill. I mean, in general, we recommend people to take iron pills with vitamin C, because that allows for better absorption. Yeah.
Oh, see, I'm learning. No wonder I'm so tired. I'm like, I'm taking it every day, but I'm so tired.
Yeah, because that's just typically how they go. That's how they get absorbed.
Okay.
Yeah.
So take with vitamin C, so an orange or lemon water.
Yeah, something citrusy. Yeah.
Okay, okay. Noted. That is definitely good. The other thing was, so I have this regimen. When should I start to see results?
So yeah, typically you can see, so I'd say probably around 3 months, you can start to see results. Your stores are not going to be replete until about 6 months. So you need to take it for a long time.
Okay.
Your iron or your hemoglobin might start to look normal, but your iron stores are still probably not completely replete, but the body's getting there.
Okay. So that's my other question. Because I know for myself, I just recently had blood work done probably a few weeks ago, but I was 2 weeks post menstrual.
Mm,
So obviously I'm going to be depleted. So my
yeah.
question to you is that when taking blood work for a checkup with my cycle, when should I go? Should I wait 3 weeks? Because by then, I'm almost time to start again. Like I've got that fine window. When should I do blood work?
Yeah. It's I'm trying to, I don't know that there's a particularly great answer. I guess probably before your menstrual period, maybe the week before, that'd probably be the easiest thing.
Okay.
But really, your hemoglobin probably should be replete by then. It shouldn't be like super low. It should probably be within reference range, I would think. So either there's a issue with not having enough iron or hasn't been depleted completely. Yeah.
Okay. So does it normally take about 30 days for the body to kind of cycle and to kind of replenish itself, you're saying?
Yeah. It should take about 30 days. So yeah.
30 days. That's good to know because I have a checkup very soon. So I'm asking for
Yeah.
myself. I'm asking for friends.
Yeah.
This is good to know.
Yeah, I will say if the heavy menses is a problem, it's probably I'm not gonna say a lifetime prescription, but probably to some degree taking iron pills, probably for a long time.
Okay.
Yeah.
And I've also had clients at work that have thalassemia. Am I saying that right? Thalassemia. Thalassemia.
Oh, thalassemia.
Yeah,
Thalassemia,
thalassemia.
yes.
Yes. Or they also have sickle cell. So they're
Oh yeah.
chronically fatigued or anemia.
Yeah.
And they didn't realize that could have been, a reason why their hair is doing what it's doing.
Yeah, for sure. I mean, probably a big reason that's probably contributing is the anemia that's from the thalassemia and from the sickle cell for sure.
Yeah.
Yeah.
You mentioned earlier as far as nutrition and micronutrients, raw veganism is back. A lot of people are especially in the Black and Brown community, that is a big lifestyle change. I tried it for about a year.
Mhm.
But for those individuals, especially women who don't consume animal products, what are safe ways that they can get good amounts of iron, especially if they're exercising? Because I think you mentioned that earlier.
Yeah.
Guys, what can they do?
Yeah, you can, I mean, leafy greens, kale, spinach, those sort of plant irons are pretty good. Edamame has pretty good protein. Um, those are the things off the top of my head. I mean, you can get the enough iron from a raw vegan plant-based diet for sure.
Mhm.
It's just you got to be really careful. You probably have to plan a little bit better. You have to make sure you're getting a sufficient amount of protein. It's not a sort of willy-nilly, I'm just gonna be vegan and not necessarily pay attention to how much protein and iron I'm getting.
Yeah.
Because I think even in general, for the general population, it's 7 to 10 cups of leafy greens is the required amount, but I'm not sure everybody necessarily gets that.
Yeah.
So
And it's very hard in this fast pace now that things are kind of reopening and we're getting
yeah.
to how things were before. I'm tired. Like this, I was perfectly fine with just chill and things not really being open. I'm like, I'm okay. But now we're almost at like full throttle again. And
Yeah.
I've got to get my mental back because
Yeah.
of that, the energy level. So for individuals that have that go, go, go lifestyle and mentality, where can they, what suggestions do you have for them as far as should they supplement too if they're not getting the macronutrients?
Yeah, I would supplement. I think probably do like a mineral analysis, see which
Okay.
ones you're actually deficient in.
Okay.
And then I would supplement because it's just not worth it, you can get I mean, you can have so many problems if you're deficient in your micronutrients and your macronutrients, and it's, to me, it just doesn't seem like a risk that's necessary.
For the mineral analysis, is that not where can I ask for that when I see a doctor?
Yeah, you can ask for it. We do it really, we do it infrequently, and usually it's for more serious conditions, but we can run them. If yeah, if the relationship is there, it's my patient and we want to go ahead and do this, you're at risk for deficiencies, we will run them for sure.
Wow.
You just
See,
got, yeah.
so many, I'm telling you, Dr. Hayes, so many gems you just shared tonight that really change people's lives, right?
Oh
Because
yeah.
especially you think about, I've been struggling with this for so long and I'm eating all the right things. I'm exercising. I'm following this very, it's not too regimented, but it's just,
Mhm.
I'm eating well, but my numbers are still showing this. So
Yeah.
should we be so fixated on numbers or more of how we feel?
I So I'm a data person, I will say, but probably to my detriment. So I think as long as you have a trusted healthcare provider, your doctor, physician, somebody who's watching you, I think the goal in anyone is to feel well. So as long as you're feeling well, I don't think patients need to worry. I think it's the onus is on the physicians to keep track. So I think, yeah, I think for patients in general, don't worry about the numbers. Make sure the person that's looking at them is someone you trust, and then do what you need to, and let them know if your things are changing.
Okay, I like that. Yeah, make sure that it's someone that you trust. So we
Yeah.
have all of this information. Um, what's the importance of having a personalized nutrition as well as, trying to medications and everything? What's the benefit of that?
Yeah, I think, man, nutrition is such I feel like it's probably the most difficult topic in medicine for sure. But I think it's important to combine the conditions you have, whether you're anemic, you have other autoimmune disease or whatever other conditions you have, in combination to the lifestyle that you want. You know, are you someone, like you said, that want to try to stick to as much vegan or vegetarian diet? Then, you know, what things can we do to make sure you're getting all your nutrients? But I think being honest in how you want to live your life in terms of the food you eat, I think is important, because honestly, sometimes we'll recommend things, but then, and I'm part of it, that may not be in line with what the patient wants. And I think it's important to consider what they want.
Yeah. So from your experience, what have you recommended that's not in line with, I guess, where a patient is wanting to go?
I don't, I will say I don't in general give like a blanket recommendation. I try to find out what, so it really depends. So I will say if I know what conditions they have, I see a lot of people with diabetes, high blood pressure, you know, as an internist.
Yeah.
So we have general idea what types of diets we can recommend to them. So those people, I will have something to offer them. But everyone else, I kind of just try to figure out, how are you eating? And try and if I can get anyone to leave sort of the standard American diet, any sort of diet is better than that, I think. For any,
that diet.
yeah.
Yes.
Yeah, so for the general population, if you're any movement away from the South American diet, it's great. And if you can reduce the processed foods, the simple carbohydrates, fructose for me, in the form of soda, diet soda, fruit juice, it doesn't necessarily need to be a part of our diet. We can limit it as much as we can. And then those are probably the, you know, other than that, I think people can generally have a good sense of what else they can eat.
Right. There's so much. There's so much that that's genetic, but
Yes.
so it's genetic in the sense of we're following the same eating habits, right?
Yes.
Like, oh, well, in my family, diabetes and high blood pressure runs rampant, but we're eating the same thing, you know, and so, you know, of course you're going to have all of that. So
Yeah.
that makes perfect sense. And I actually was interviewing another healthcare professional. She's a nutritionist, and she's in India. And so she was telling me that when she first came to the States, she was recognizing how malnourished Americans were, but we were overweight.
Yeah.
We were still malnourished because we were eating all of this junk that had no nutrients in it. And so when she was working at the women's hospital, maybe like a shelter, she was seeing what people were being fed. She's like, this is bad. And so for her practice, she actually incorporated her Ayurvedic techniques from back home.
Oh, wow.
That's what she knew, and that's what worked. And so that, you know, she was helping her patients, you know, with diabetes and high blood pressure, because a lot of it is lifestyle related.
Right.
Yeah.
That's awesome that she did that, for sure.
Yeah. It kind of reminds me of you in a way, because she's very intentional, very intentional with her patients, and looking at patients as an individual and trying to wean them off of their medications if possible, and teaching them healthier choices. Now, I know for myself, in my family, we do have quite a bit that have high blood pressure and that are also diabetic, type 1, but also type 2. And sometimes it's really, really hard, because your life is revolving around food. You know, even when you're eating, you're thinking about your next meal.
Yeah.
And it's like, okay, I know I'm hungry, but you have these swings, you know, which also affect your mood. And then you get tired. But then if you take insulin, you know, how much insulin, I mean, it's very overwhelming.
Yeah.
Very overwhelming.
Yeah, I 100% agree with you. It is so hard. And I feel for everyone. And it's definitely, like you said, there's obviously a genetic component, we know that. And I mean, like you said, there's sort of an environmental component too. When food is around you, it's hard to do. And then the swings is basically a sort of an end product of the constant high carbohydrate, high high fructose, corn syrup, that sort of stuff that's going on. You have swings, high blood sugars, and then you start crashing. It's up and down, and you get hungry. So yeah, it is a problem.
It's exhausting. So but I'm happy that we're having this conversation, because like my goal and your goal is to share this with other people, and where they can have evidence-based information to where they can make better lifestyle choices.
Yeah, for
And then
sure.
they can share that with their friends and family, and then potentially change the trajectory or the direction of their family dynamics. I'm like, hey, this is something that's really simple that we can do. It doesn't have to be drastic, but it's just one small change. Cutting out the top, getting rid of your
Perfect.
top and replacing it with water. If you're not ready for that, maybe, go from sweet tea to unsweetened tea, kind of gradually work your way there. You don't have to go cold turkey.
Yeah, no, I mean, honestly, that's that's the right way to do it. That's how I do it with, if you're, that's how I do it with my patients. If I mean, I'll tell you one anecdote. I had a patient who came with me with an A1C of 11. All we did was she stopped her soda. That's it, her soda pop. And then I saw her 3 months later. This lady, her hemoglobin was 6, her A1C was 6. And I'm like, what did you do? She's like, I just stopped the soda. I was
Wow.
amazed, and it's, I think part of it is the cravings will go away, that sort of thing. It's probably playing a role, but like you said, one step at a time, I think, can make a big difference.
Yeah. Well, patients are very blessed to have you. In their lives.
No.
No, I mean, seriously, it's just, it's nice. It's a beautiful thing to have medical professionals that are on your side, and that are open to nutritional things too, and understanding what your goals are, potentially coming off medications, not being on something for a long time, but helping us as patients being able to reach our goal and to to stay the course. So that's a wonderful thing to know.
Yeah.
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 So this has been a great conversation. I really enjoyed it. I've learned a lot just in these last 30 minutes or so. And I'll recap for myself that although I've been taking my 65 milligram iron every day, I learned today that I should probably take it every other day, and that I should also take it with vitamin C, whether it's lemon water or an orange or something citrus related. I should definitely do that so that my body can absorb it. That was a great point. The other point that I really appreciate that you brought out was if I'm susceptible to having different types of deficiencies, that I can actually ask my provider for a mineral analysis.
Yeah.
Did not know that I could do that.
Yeah.
So that's great. Yeah. So you're giving me all the gems here. And then let's see, what was the other one? I think you also mentioned too that hair loss is a symptom of something else that's going on. So realizing the time frames of things and kind of deep diving into what happened months ago, whether it was pregnancy, extreme stress, sickness, something like that. Because for me, I've always said that the body leaves clues.
Yeah.
We just
You're
have to listen to it.
Yeah.
So it tells us, so not to be fanatical about things, but just to to listen to it. So
Yeah.
I like that. Well, thank you, Dr.
Yeah. No, it's been my pleasure. Yeah. I mean, I enjoy this. I mean, I love being able to help people in this way. And I think in general, like who, patients who are listening, your clients, that I think it's so important. There's so many different people out there. Make sure you find someone who's open. I'll say that. And the other thing I think people don't realize is you can pick and choose who you see. you know, it's not necessarily limited to what your insurance provider necessarily gives you, you know, and, you know, we're trained to be lifelong learners. So find someone who's always reading, learning, keeping up with the data, that sort of things, and especially to make sure they're in alignment with what conditions and problems that you have, or what their interests may be. So
I love that. Yeah, I love that. It reminds me of the conversation I had with another doctor. She's a dermatologist, Dr. McMichael. And she was telling me, she's like, you know, when you find a dermatologist, make sure that they're board certified. I'm like, what do you mean by board certified? She's like, that they are board certified dermatologists because they stay up to date with
Yeah.
dermatology. Like, you know, anybody can be board certified, but if it's not in their field, that's different.
Yeah,
Yeah,
absolutely.
just kind of like what you were saying, you know, you're staying abreast with what you do.
Yeah, and board certification is that because we're required to maintain, you know, even every couple months, we're required to take courses and keep up. And the standards are very high just for any specialty. So
Okay.
that's true. That's important.
Yeah, well, that's good. So if individuals out there that are listening in internet world, if they would love to find you or have additional questions, how can they reach out?
Yeah, they can just email me for now, really just sharing information. So
Okay.
yeah, so it's Eman, Eman, Yousif, YOUSIF5 @gmail.com.
Okay, cool. Thank you. So I will, I'll share that and kind of type it in. So if they have additional questions, which I'm sure they probably will, but this has been really good. So thank you again for taking your time out of your busy schedule for doing this. And for those of you that are listening, once again, this is one of the benefits of being a part of our In Living Curls hair care community. You get hair care advice, lifestyle, but also interviews with the experts when it comes to medicine, wellness, and just overall, you know, lifestyle things. So definitely stay tuned in. And this is once again, this is your favorite stylist, Melanie Day with You've Got Curls and Hair Loss Center. Until next time, bye everybody.